Telehealth Psychiatry, Prescribing Controlled Substances Explained. Have you ever wondered how telehealth psychiatry works when it comes to prescribing controlled substances? This is an important topic, especially for young people seeking mental health support. Let's break it down in a straightforward way. In telehealth psychiatry, psychiatrists can prescribe medications that have a potential for abuse, like stimulants or certain pain medications, through remote consultations. These medications are classified into schedules based on their risk of abuse. For example, Schedule Roman II substances are considered high risk, while Schedule V substances are lower risk. One key piece of legislation is the Ryan Haight Act. This law traditionally required psychiatrists to meet patients in person before prescribing controlled substances through telehealth. However, due to the COVID-19 pandemic, some temporary changes were made. Now, psychiatrists can prescribe these medications without an in-person visit under specific conditions. This flexibility is available until December 31st, 2025. When it comes to initial evaluations, psychiatrists usually need to see patients in person before prescribing controlled substances. But during public health emergencies, this requirement can be waived. New rules may soon come into play, possibly reinstating some in-person visit requirements. Another important aspect is the Drug Enforcement Administration. They are working on special telemedicine registrations that allow qualified psychiatrists to prescribe certain controlled substances without an in-person visit. To qualify, clinicians must meet specific criteria, including board certification in psychiatry and following strict protocols for patient verification. Psychiatrists must also follow both federal and state laws. Some states have their own rules about prescribing controlled substances through telehealth. For instance, some may requiring regular in-person visits for ongoing prescriptions. Before prescribing, psychiatrists often check prescription drug monitoring programs. These programs help track a patient's history with controlled substances, which is essential for preventing misuse. For young people, telehealth psychiatry can make accessing mental health care easier. It helps those who might face challenges like transportation issues or stigma. However, understanding the rules around controlled substances is important. It helps patients and their families know what to expect regarding evaluations and follow-up visits. Telehealth providers use secure audio-visual technology for evaluations and requiring photo identification to confirm patient identity. Electronic prescribing and regular monitoring are also in place to ensure medications are used safely. In summary, prescribing controlled substances in telehealth psychiatry is about balancing access to care with safety measures. The current federal flexibilities make it easier for young people to receive necessary medications remotely, but these rules may change as new regulations are developed. Being informed helps young patients navigate telehealth services confidently and safely.